Okay. Um, so if a patient maybe has the normal quote unquote brain MRI, they don't have any into the cervical cord, there's nothing going on in there. What are the other disorders that can mimic those symptoms that maybe should be checked, especially if the symptoms are pretty bad, before you go through with Chiari surgery, I guess?
Yeah, well, so in your scenario, Caitlin, they don't have a Chiari on their MRI, is that right, or they do?
They don't. So they have all the symptoms, and it's bad enough that something should be done, but there's
Yeah.
nothing visible.
Right. Well, without a visible Chiari, we wouldn't do a Chiari surgery. So the sort of the whole concept of like, what should I look for before Chiari surgery? Well, I wouldn't do the Chiari surgery if there was no Chiari. Other things that you have to look for, kind of depends exactly what the symptoms are, frankly. I, I don't think it would be fair to just provide a laundry list of all sorts of neurological conditions because they all have individual presentations and symptoms. Um, Things that can often be confused with Chiari, though, are obviously tumors. Can cause headaches. They sometimes can be relatively hard to diagnose if they're diffuse tumors. Cerebellitis can do a lot of those sorts of things. CSF leaks can mimic Chiari on MRI and can cause incredibly awful headache problems and can be very, very hard to diagnose. Lots and lots of people in America, even today, with CSF leaks can go through multiple doctors before they're properly diagnosed. And that can be a terribly, terribly devastating problem to have with incredibly bad headaches. So that would be something I guess I would keep in mind as well. But honestly, it just depends on the symptoms. It's hard to know unless you knew what the symptoms are. And then, the other fact of the matter, though, is that just a lot of people with headaches that do not have an MRI abnormality probably do not have a neurosurgical cause of their headaches. I mean, most headaches do not have a neurosurgical cause. And it doesn't mean that they're not a terrible, awful problem. It just means that surgery will not help. And at that point, they need to work intensively with a neurologist, headache expert to try to get their symptoms better. And the good news is most of the time that's effective. But it is something that I think people struggle with because sometimes the severity of the symptoms would indicate that there must be something that needs surgery, and that's not necessarily true.
Yeah. To the point about headaches, I know we kind of talked about this, but what actually is a Chiari headache? And at the back of your head, you can get a bunch of different types of headaches. So how do you know how to differentiate that?
Yeah, so the American Headache Institute actually has a headache classification, which is really helpful. They have like a migraine headache classification and a tension headache classification, and actually they have a Chiari headache definition now, which a really good expert panel of neurologists came up with. I was slightly disappointed when I read it. It is helpful, but unfortunately, like their main way of diagnosing Chiari headache is that they call it a headache that gets better after Chiari surgery, which is true. And it is a really neat definition, but it's not helpful if you're a patient trying to decide if you should have surgery for your headache, because you're not going to just do the experiment and find out if it gets better and to find out if you have the Chiari headache or not. But so that was one part of their definition. The rest of their definition was more helpful, and I do agree with it. And so they were pointing out headaches that are in the back of the head that are generally short lasting and that are brought on by coughing, sneezing, straining, exertion, are very likely, especially in combination, are very likely to be Chiari headaches. Now, Chiari headaches don't have to be that way. Obviously, everybody knows and have seen instances of headache that are associated with the Chiari and that do not neatly fit that description. But if we're making a surgical decision, it's just a statistical fact that we're much more likely to help people recover from their headaches if they have headaches that fit that description. So if somebody comes into the clinic and they says they have a headache in the back of their head and it lasts for 5 minutes every time they lift weights and then they get better after a few minutes, again, there's an extremely high likelihood that we're going to fix that. And if somebody comes in and they say they have headaches all the time in the front of their head, just statistics, and it's not just our clinic, every study has shown that that's a person who's going to have a much lower likelihood of getting better from their headaches, but not zero. It's never zero. So sometimes people will get better from their headaches, even with that sort of a description. And I've had patients that I've operated on because they have a great big cervical spine syrinx, and I've recommended an operation on that basis. And then they'll give me a headache description, which is one side of my head up front. It lasts all day. It's awful. And I said, we should fix your Chiari because of the syrinx. By the way, I'm not really optimistic about your headache. Let's not do this operation for your headache because I don't know if that's going to get better. And then it gets better. So that's great. I love it, but it just goes to show that I certainly can't predict with any degree of certainty in many cases who's going to get better and who's not. But we can make general guesses on the basis of the headache classification that I mentioned to you. Eventually, a headache description goes so far off of what we are looking for with respect to a Chiari description that it's hard to justify taking a chance on surgery. If I honestly think you have a 10% chance of getting better, then I don't think you should expose yourself to the risk of brain surgery. That shouldn't be good enough. You should have brain surgery if there's at least I think a better than 50-50 chance that your headaches are going to get better. I think just as a baseline, that's where I personally would set my baseline. Other people might feel differently. This is not right or wrong. This is not exactly science, but we got to call it somewhere. And for me, I think I will sometimes offer a headache operation to somebody who I think is going to have a 50-50 chance of getting headache relief, but I'll want to make sure to counsel that patient very carefully and tell them that this may or may not work, and we're going to have to decide if you think it's worth going through and exposing yourself to the risks. So having said that, that was the other part of your question. What are the risks? The most commonly seen risk of Chiari surgery in America right now is getting CSF leaks and pseudomeningoceles. Unfortunately, very common. I try to be really, really, really careful when we close the dura when we do Chiari surgery. So in general, I don't get any CSF leaks in my practice. But in America today, that's the most common thing is you either get spinal fluid leaking out your neck after surgery, or you get a great big bulge in the back of your head from a pseudomeningocele. And those are incredibly problematic. When people get those, it can cause chronic pain. It can just be absolutely miserable. In my opinion, when people get those after surgery, it really should be fixed right away, and not by putting a shunt in. It should be fixed by going back to the Chiari repair and doing it properly with a really good closure of the dura so that you don't get a leak, so that you don't get a chronic neck pain problem, which is what those can turn into. So CSF leak is the most common thing that you worry about. You can get an infection just like with any other operation. You can get an infection. Pretty uncommon, fortunately, with brain surgery because the scalp is so well perfused with the great blood supply. But it definitely can and does happen sometimes. Really severe problems like brain injury, strokes, that sort of thing should be incredibly rare. It can happen. I'm not going to name a name here, but one of the people in the field who I most admire, and I really believe he's an excellent technical surgeon, has lost a patient on the table. The patient actually died in Chiari surgery, and I do believe that this surgeon is an excellent technical surgeon, and that I would feel very safe having him operate on a loved one of mine. But he's lost a patient in Chiari surgery, so I share that story with some of my patients because I want them to understand that anything is possible when you sign up for an operation, and you don't expect something really terrible to happen. And that's a incredibly unlikely event. Obviously, it's the worst thing that's ever happened to in this person's career, but it's not impossible. Brain surgery can be serious. So I personally have never seen any permanent brain injuries or deaths or anything like that in the practice, but it's not impossible. There could be a first time for something serious like that.
Yeah. There's no such thing as no risk. So
that's right.